Hey there, welcome to episode 13 of the Boob Report podcast, powered by Helix Interactive. Today I'm hanging out with Christy Cahill, the Executive Director of the Colorado Cancer Coalition, and we're going to be looking at the resources available to people here in the state of Colorado. This is going to be fun. Let's get started. All right, and here we are. Thank you so much, Christy, for joining us. So excited to have you here.
Thanks for having me, Michelle.
Yay. All right. So I met Christy through some mutual contacts here in Colorado, and she is going to discuss with us today the Colorado Cancer Coalition, which I am very excited about because they have such an amazing amount of information that they are so willing to share with us through the Boob Report, which is fantastic. So Christy, tell us a little bit about the coalition and how you got started with it.
Sure, yeah. The Colorado Cancer Coalition exists to help eliminate the burden of cancer in Colorado. And how we do that is by bringing together people that work anywhere in cancer and having them collaborate and network and not reinvent the wheel. You know, there's so many great things out there. And so how do we make sure that people are collaborating, working together, filling gaps? And I got involved with the coalition back in 2009, actually, right when I moved to Colorado. I was coming from a cancer nonprofit in Texas and trying to get involved here in Colorado, and found the coalition and started volunteering as a coalition member back in 2009, and then have just been involved ever since then, and in 2020 became the executive director. And now I get to lead the coalition, and I just get really energized by seeing collaboration happen and seeing these innovative programs and new things pop up that help fill gaps in the state in Colorado when it comes to cancer care.
Well, I think that's so amazing. And you're right. There's so much information out there. So to be able to bring all of that together is, I'm sure it's pretty difficult because, you know, Colorado's a decent sized state and you guys map things out. You and I were talking before we got started on the podcast. It's usually a 4-year plan that you guys do for the resources.
Yeah, it's a 5-year plan. So
sorry, 5. I can't do math.
That's okay. It's generally a 5-year plan. And we're on our 25th year of having a cancer plan here in Colorado. So in July of this year, we launched the 2021 to 2025 Colorado Cancer Plan. And it's the vetted roadmap to reducing the burden of cancer in Colorado. So over 100 stakeholders come together to provide their expertise on what we should be prioritizing along the entire cancer continuum. So from prevention, screening and early detection, treatment, clinical trials, survivorship and quality of life, and palliative care, even some end-of-life stuff. And then there's some cross-cutting information in there around health literacy and patient navigation. But these experts come to the table to help us prioritize where should we be focusing our efforts? Where are there gaps? What new technology is out there, or what new priorities are there just in cancer care that we should be focusing on? And then we take that plan and then start to implement the strategies in it all throughout the 5-year period.
Wonderful. And then you guys also, this includes like a resource map for people to be able to see where there's different resources available throughout the state, along with a list of support groups.
Yeah, on our website, we have a cancer resource map where you can actually, you can search by topic for what you're looking for. And then when you click the topic, it puts dots on the map. And so then you can zoom in to where you actually live and find resources that are close to you. So you can find low or no cost cancer screening locations. You can find supportive resources. There's genetic counseling listed on there. Palliative care is now listed on there. So it's a really exhaustive list of resources that hopefully you can find in your community. One of the things we'll be looking at is on that map, where are we missing services? So are there parts of the map, are there parts of Colorado where, we don't have palliative care services? Okay, how do we bring palliative care out to those areas? Does it need to be telehealth? Do we need to, some of the cancer plan is growing workforces, so growing navigation workforces, growing things like that, so that there are enough navigators out there to actually meet the needs of patients and caregivers. So yes, we have that cancer resource map, and then we also have a support group listing. And the support group, you can search by your cancer type as well, so you can find the right support group for you.
Oh, that's wonderful. I'm just going to bring this up because I think I see the look on people's faces sometimes when palliative care is mentioned, and I don't think a lot of people understand exactly what that is.
Yeah, good question. And it's one of those things we want to change and have it be brought in earlier in the conversation, because it does not mean the end. It's just making your treatment more comfortable. So everybody should be, talking about palliative care when they're diagnosed. There's a difference between the palliative care and hospice care and end of life care. So it's one of those kind of educational pieces that we've been working on to try to get people to ask about bringing the palliative care team in, and kind of changing the myth about palliative care.
Right. Because I think a lot of people tie that in with hospice and they're not really sure what it is. And it's, it varies depending on the process you're going through with the cancer. I mean, I didn't have to go through chemo or radiation. So my care was completely different than a woman who had to go through either chemo or radiation or both.
Yep. Yeah, exactly. Everybody's path is totally different, but being an informed patient and, knowing the questions to ask and knowing the different services that are available to you, I think are important. And so that's another thing that we touch on is shared decision-making and trying to help patients really be advocates in their care so that they can ask those questions, get the right people at the table, and have a whole team of support around them through treatment.
Right. Now, when you mentioned that the group that you bring together to help create this 5-year plan, the resources and everything like that, how do you guys go through and bring these people on board? Is there like a vetting process, or do they volunteer? How exactly does that work?
Yeah. So we're on our 6th version of the cancer plan, and it's varied from every 5-year period when we redo it. But we have task forces made up of experts in different fields. So we have a lung cancer task force, a colorectal cancer task force, skin cancer, HPV vaccination, and survivorship and palliative care. We're actually bringing back a breast cancer task force and a navigation task force, and also starting a new clinical trials and treatment task force. So experts volunteer their time, experts, patients, caregivers, people that work in the nonprofit field, local public health, state public health, and anybody that has an interest in cancer work can join these task forces. So they help with writing the plan, and then depending on the particular chapter we're working on, we also reach out to other experts in the field. Like, for example, environmental exposures, we'll reach out to the state health department to have them help vet those goals and priorities and come up with those strategies.
That's awesome. Now, if someone wanted to volunteer for that, I know we're going to provide links on the website and how to get to your website in our little synopsis of the show. But if someone wanted to volunteer for something like that, to be part of a task force or, share their informational expertise or anything like that, how would they do that?
Yeah. So if you go to our website, there's a tab that has the task forces listed on it.
Mhm.
And on each of those pages, you can find the task force that you're most interested in, and you can click to get added to their email list. And some of them meet monthly, some of them meet every other month. Each task force provides education and a networking opportunity for people that have similar work interests.
Mhm.
And that's really where we get our work done too. The task forces help implement the cancer plan and help improve care and hopefully outcomes for everyone in Colorado diagnosed with cancer.
That's amazing. I'm gonna have to check that out because I'm very interested. Anything that I can do to help women and men that have a diagnosis of breast cancer. I think that just being able to volunteer and offer information. I know I sat on a task force for one of the local hospitals here for a little while for breast cancer care, as having someone just from the community come in and speak to the doctors and nurse navigators and things like that, and just walk them through my process and how it worked so that they could see what they could do to improve that for future patients coming through the door.
Yeah, that's awesome that you had that opportunity and that they were asking that.
Yes.
That's really, really great to hear. And, I think you take, in an ideal world, they could take what they learned from that conversation with you.
Mhm.
And then if the task force that we have, they could come back and be like, here's a few things that we've changed, and this has improved the patient experience or improved outcomes, sharing it with other hospitals and clinics. Because, I think we all tend to be a little bit siloed where we work, what we do, even across cancer types. It's like siloed between the breast cancer world and other cancer types and things like that. And so the coalition is really that neutral convening ground where you can share best practices, network, learn from each other.
Mhm.
Again, so nobody's reinventing the wheel. We're all better when we're going together, and we can do so much more learning from each other and really collaborating for the greater good.
Oh, absolutely. I totally agree with you. I think that communication is key. That again, I was talking about this with another survivor. I literally had no idea how many different types of breast cancer there was. I mean, when I heard breast cancer, it was just, oh, okay, it's breast cancer. That there's so many different types of it, and there's just so many different types of other cancers as well. And being able to have a group come together and work through that process to make the information that they share a little more user friendly, if you will, I think is just an amazing asset to have on the state level.
Yeah, it's it's all overwhelming and with healthcare. Let me think.
No, I threw you a curveball there. Sorry.
Yeah, I think it goes back to the what education can we all provide so that it gets you thinking like, okay, what questions should I be asking? Like, should I be asking about biomarker testing before I go down a treatment path so that I can make sure I'm getting the right therapy for my particular cancer type? So I think helping come up with those really easy tools to be an informed patient, making sure, coming up with those tools and getting them into the hands of patients is really important.
Oh, I think so. Because I think I know myself, I felt more comfortable having the information going in. It did help that my husband was with me, through my journey, but a lot of women and men actually have to go through this journey by themselves. So, to be able to be informed and be able to ask the right questions to get the information that makes them feel more comfortable, I think is essential for a lot of people. But now you and I were talking beforehand, before we hopped on to start recording, and every state has something similar to what we have. You guys with the Colorado Cancer Coalition, you guys are set up as a nonprofit for the state of Colorado, but your counterpart in, say, another state may not be a nonprofit. It may be an entity within the state. Can you kind of walk us through how that might work?
Yeah. So every state has some sort of coalition, and so ours here is called the Colorado Cancer Coalition, and we have a fiscal agent. Trailhead Institute is actually our fiscal agent, so we get our 501c3 through Trailhead, and they help handle the accounting and kind of back office type stuff, so that I can really focus on the programmatic work and implementing the cancer plan. So each state has a coalition of some sort. It might be called a consortium, it might be called something different. And some of them are their own standalone nonprofits. Some of them are set up as membership organizations and collect membership fees. Some are out of the state health departments from their comprehensive cancer units. Some are out of universities or like schools of public health. So it looks different in every state, but each state has a coalition of some sort, and each state has a cancer plan as well that helps drive their work.
That's amazing. And again, until you and I met, I had no idea that that was available. I mean, I had heard of you guys, but not really, it didn't really click as to everything that you were doing. So what you guys do is so essential. And to be able to have you on the show and then work in concert with you to get the information out, I think is going to be hugely beneficial for the women and men of Colorado.
Yeah, I'm glad that we were introduced, and I got to see what the boob report was working on. And I think we'll just continue the conversation, because more and more resources do pop up, and so I think one of the biggest things I hear from survivors is that they don't hear about any of these resources until they're done. Like once they kind of join the advocacy world and start to get involved and volunteer, then they find out about all of the resources that could have been super helpful to them. Right. So how do we get this to them at the right time? I mean, there's so many different answers to that question. I think it's, as soon as you hear the word cancer, like your brain just shuts down. So, you can't give them the information then. And then there's also the factor of like, there's just not enough navigators and social workers to meet the need of all the patients that we have. Colorado's unique in that cancer is actually the leading cause of death in Colorado. Most states, it's heart disease or other heart-related issues, and so it's a big deal here. There are 23 Coloradans die a day from cancer in Colorado, and so how do we find them sooner and get them the information that they need so that they can be empowered patients? They can have the quality of life that they deserve going through treatment and even beyond. I also hear that like the day you're told that you're cancer free is also a scary day, because then you're like, well, wait, where do I go from here?
Yeah, what happens? Yeah, it's like, whoa, yeah.
So how do we get the right information into their hands at the right time? And I think you're trying to do just that, trying to provide that resource that can help them ask the right questions, help them find what they're looking for. So
absolutely. Well, and you spoke to that, Christy, that so many women come back and say, oh, well, I didn't know that was available. I didn't know that was, I could have gone that route or something like that. An example for me was my surgeon set me up for physical therapy before I even had my bilateral mastectomy. So I just thought that was normal. I went and met the therapist before I even had the surgery. She took measurements, did my strength and all of this. And then 3 weeks after my surgery, I started going and seeing her on a regular basis. And it is amazing to me the amount of women that did not know that that was actually available to them. And it helped me tremendously because I had the expanders put in. I didn't go right away with the implants. I had expanders first for 90 days, and then I went and had the implants put in. So yeah, so being able to have that information available, I think is vital. And that's the whole point of me doing this, is that I want to be able to give back. My journey wasn't as difficult as a lot of women's. And so I wanted to be able to give back and have that information. Because you're right, when you get that cancer diagnosis, it's like, what just happened?
Yeah, I mean, thank you for sharing that with me. It sounds like you were lucky with a very proactive physician who said, like, this is going to help your recovery. So get plugged in here now so that you can go straight to this. And I think, that's one of the things that one of our goals is around increasing access to quality treatment like that. So it shouldn't matter if you live in the metro area or if you live in rural and frontier Colorado, you should get the best possible care that you can get. And so how do we both educate the patient to ask those questions of like, hey, can I get set up with PT? But also, more importantly, how do we make sure that all the clinicians and physicians are recommending the same things to everyone?
Right.
And really getting that standard of care and that quality of care up and higher so that everybody has better outcomes. Because you can see if you look at some of the data in the state. I was just presenting last week, and in Colorado, the incidence for Black females of getting breast cancer is lower than whites, but the mortality rate is higher. So less Black women are getting breast cancer, but more of them are dying from it than others that are diagnosed, that have more diagnoses. Sorry, I'm trying to describe it.
Okay. That's okay. Extrapolate all of it. Yeah. So is that in Colorado or is that,
yes.
Oh,
yes.
wow.
That's in Colorado. So
oh my gosh.
So why is that?
Right.
And again, lots of answers to the question, but they might be finding it later through screening. So then they're diagnosed at a later stage. They might live in different parts of the state where the access to cancer care is just more limited. So these are the types of things that the cancer plan looks at. And then our task forces will try to, bring the right people to the table so we can really start to address these questions and make changes wherever changes need to be made.
Oh, well, like I said, I am so excited and so grateful that you and I were introduced to each other, because you will be a frequent guest, just so you know, on the podcast, so we can keep people updated. And I'm really excited to be working with you going forward to make sure that we have the most updated information that we can share on our website to direct people to this website. And as you and I were talking beforehand, I'm going to start reaching out to other states and do the same thing, because my eventual goal is to take this nationwide for the boob report, so that women can just click on the website and really see where they need to go to get their questions answered.
Great. Yeah, I'm happy to connect you with my counterparts all across the US.
Oh, this is awesome. It was just serendipitous that we met. I'm so excited. I'm just like, woo, we got to have a party now. So, well, Chrissy, I thank you so much for joining us today. I truly, truly appreciate it. And I'm not kidding. You will be coming on again at some point, everybody, because she's amazing with the information that she's able to share with us. So I truly appreciate your time today, and looking forward to talking to you again.
Thank you for having me. And, thanks for providing the resource with the boob report that you'll be providing. Again, we're all better working together and getting out of silos. So I appreciate the conversation. I appreciate everything you do. And I look forward to seeing the boob report site just continue to grow.
Thank you. I appreciate it. All right. We're going to sign off. Such an informative conversation with Christy. So glad I could get her on the show. We have links and information where you can learn more about Christy and the Colorado Cancer Coalition on our website at www.theboobreport.com/podcast episode 13. You'll find links and more information in the show notes. And a very big thank you to all of you for spending time with us today. Be sure to like and follow us, and definitely share the podcast with your friends. You can become an active listener and support us by clicking on the podcast link on our website at www.theboobreport.com. Thanks, everyone. Take care.